Hello, I'm Dr. Mark DeBrincat. And for the last 6 months, I've had several people ask me if I've heard about this P90 Plus device from a company called OlyLife. And I did do a little bit of due diligence with it. And I'm very familiar with PEMF technology, which is one of the technologies in here. And it looked pretty simple, pretty basic. And so I had passed. Well, after several people have been ranting and raving about the results, I have finally decided to take a glimpse, a little look into this product and do my own case study, if we want to call it that. And so, what you're about to see is an example of just two different patients, both in good mental health. I took a patient who's 59-year-old female with no complaints and is in great health. And the other is a 34-year-old female that has had a severe spinal injury. And we've been working very close with her in optimizing brain function and neurology in her body. And so, we're going to see a case of somebody that's been trying really hard to clean and clear the brain function and another brain at rest. So, with that, let me go ahead and begin. So, as I mentioned, the two different patients, and the baseline here that we're going to be doing is a QEEG brain map, eyes open and eyes closed, so I can get an idea of what's going on during the day and how efficiently and effectively they can calm it all down and rest at night. When nighttime is when we're doing most of that healing. So then we had them put their feet on these plates that you see in the picture here of the P90 Plus, and they performed a 20-minute session on level 5. We also did a post QEEG brain map, eyes open and eyes closed, immediately following the session. So in these brain waves, we're not saying, hey, there's an ideal brain wave for everybody, like it's a fixed thing. It's the ability for your body to adapt and change when it's necessary to change, but also come back to homeostasis, which is this great place that our brain is just happy, healthy, and thriving. So the first thing I'm going to show you is an image of a cortex. And the image on the left was right before the treatment or the session, and the image on the right is right following. So, what do these colors mean? Well, an ideal healthy brain should be all gray. When we see something that's yellow, it means it's 2 times too fast, and red is going to be 4 times or more too fast. So it's quite often that too many people have a lot going on in their head and they can be easily distracted and have a harder time focusing, especially in the frontal part of the brain, is that frontal cortex in which we do need to use to be able to focus and pay attention and such. Now, ideally, our brain should be gray, as you see, and so a considerable amount of change to half of her brain just by sitting and putting her feet on this plate. Now, the second patient that we did this on also had some very similar changes, again, to that frontal cortex. Now, remember, the cortex is the part of the brain that you think, feel, say, and do. It's the outer inch of our brain, but it's the only part of our brain that we control. So we experience life through our cortex. So the more gray we can become in this particular image, the healthier and more vitality we have within our brain. The next category is going to be coherence. Coherence is how well can you just comprehend things that are coming at you all day long. And we're literally making thousands of decisions. Have you ever had a conversation with somebody and then have to ask them, did you just hear what I said? And even though they might have been looking at you, they were thinking of something else and maybe not paying attention. Well, here, a healthier brain is going to be fewer lines. When you have fewer lines, you're comprehending things, you're present more, and not, again, distracted would be another way, but these are the fibers that are the white matter inside your brain that you don't control. So when we see blue lines, it's just taking too long to get that information through, if it even makes it through. When we see red and yellow, that information's bombarding so fast, it's hard to comprehend it. So again, the fewer the lines, the healthier the brain. So we can see this cleared up her brain pretty quick in just one session. And this next category is called lagged coherence. And in lag coherence is when we have the patient study and focus on an object, not look around the room and try to just pay attention to what you're looking at. So in that exercise, the brain should clear up all the lines if you truly have the ability to dial in and focus and not be distracted. Now, we live in a day and age that we're so used to swiping and having some kind of stimuli that it's really hard to focus on something that's boring and it's not doing anything. So, this really gives us a good idea of the mental flexibility that this person has and their ability to focus. So, we can see just in one session, so many of those lines got clearer and lighter. Okay, those are both two good qualities to have. And so that is a very positive effect from this treatment. And then the second patient that I mentioned, we've already been doing so much to help keep her brain and get her brain back as healthy as possible. She only had a few lines to begin with. But here's the point, it doesn't matter if you've had major issues, it's going to help those things first. If you don't really have things that you can consciously know, it's still getting in there and affecting. And for those that are elite in trying to do optimize every little thing that they can, it still helps those people at the higher functioning levels as well. The next thing we're looking at is all the networks in the brain. Each of these purple dots represent a specific region of the brain. And think of it like a big group text. Whenever we see lines, that's somebody being blocked or somebody talking over the other person, which would be like the red and the yellows versus the blue lines, which their communications being too slow or maybe not even happening at all. So it's very common when I turn on all the networks in the brain to see so many lines that I can't see through it. Even when somebody is a healthy, functioning person, we can specifically look at any one of those networks to see what it controls, and that might be the symptom that they're having. So this allows us to really map in and see some real specific things of how well this person is performing in their brain or not. So to see this much change, especially those blue lines, those are the ones that are more concerning because they're basically not talking or taking way too long to answer. We see so many of them come back online. When we see all these purple dots and fewer lines, that is a healthier functioning brain. And then on the second client, we can see that, okay, she already had most of her brain cleared. It's doing fantastic. It's really great to see a brain that's so optimized. And then we put her on this treatment. And next thing you know, she was able to clear the rest. That was probably one of the most impressive things I've seen with this technology to date. When we look at specific regions of the brain, this is the posterior part of the cerebellum. Now, the cerebellum controls all motor function in the body, and this is somebody who has lost motor function in the lower part of her body. So, we've been working really diligently at clearing this network to be able to have the brain be able to tell the body what to do and be able to get those signals through. And so, again, we've been working really hard at clearing these lines. There was only a handful left on the left, but on the right, we see it cleared over half of those. So again, it makes me very interested in this technology to see what else is it doing that I don't even know. Here's another part of that posterior cerebellum that actually cleared this section completely. Very impressive. So at the end of the day, what does all of this mean? How much change happens neurologically? Now, typically, when we test different products over the years, we see somewhere between maybe 10 and 25% change, and we get pretty darn excited about that. And as of recent years, we found better brain hacks, better things that affect the body. And we've been seeing in the 40s and 50s quite often, actually. So to see this meet some of the things that I have found over decades of searching and trying that can really impact the brain is pretty remarkable in and of itself. Then we see these two gauges on the side. So we had 40% total change. What kind of change is that? The left, it says reorganizing. So think of the reds and the blues, like we have too much energy over here or too many signals and not enough over here. So we're basically not giving you more energy. We're teaching you to redirect and balance that out and take some from the abundance and give it to the weak part. And that's how we bring balance back to the brain initially. Then we start growing new tissues to strengthen that connection. So typically, whenever I test a product, it might be 80% reorganizing and 20% normalizing. Normalizing can be two things: either neuroplasticity, that you actually started growing new tissue in that area, or maybe you just activated an area that had been switched and turned off for whatever reason. But what's happening here is that neurological function has been restored. So we can see 50% change in neurological function being restored and 50% reorganizing. That got my attention. And I thought, well, maybe it's just a fluke. Well, guess what? The next map was demonstrating the same thing. And even the next map, even though it was 34% total change instead of the 40s, it was still that 50-50 split. And so this was exciting to see nonetheless. And it's warranted us to basically think, I need to do a lot more studies on this. But the conclusion I've come after just these 4 brain maps was that I'm starting to see signs of consistent change despite the case and the severity or need of the patient. It's also helping restore those dysregulated brainwave pathways that most cases don't just balance themselves. And it's also helping us restore the brain in general and just bringing it back to balance. There's lots of things that I've seen over the years that can do this, but this is certainly a very simple one. And even more intriguing, it's very cost effective for so many people to be able to appreciate this abundance. And this, as far as the simplicity of it goes, well, they keep the actual frequency secret as a proprietary strategy. Um, and at first, I had a problem with that because I have the ability to target in and treat very specific things. And I can't do that with this device. But this device was meant to be used at home. And what a greater concept than to have one setting and we just turn up the volume. So as of now, I'm pretty impressed, and I would say this is a thumbs up product. Thanks for viewing and have a great day.